Hello, and welcome to another episode of Let's Talk About Shh. This podcast is aimed to help you navigate your relationships, maximize your pleasure, and get the most out of your sex life. Each week, we cover different topics related to the full spectrum of sexuality, romance, dating, love, sex, you name it. If this is your first time tuning in, my name is Tila. I'm a sex educator, relationship expert, and published author. People often ask me why I choose to get into sex ed, and it's because it is literally my favorite topic. I love talking about sexuality. I love helping people connect with and understand their own sexuality and foster healthier relationships. So if you're struggling with an area around sexuality or relationships or gender or sex, and you have a question that you'd like answered, please send in your questions to questions@exploresextalk.com. Today's episode, we are going to talk about birth control. This is still one of the number one topics I get questions about, and it's because there's a lot of different types out there, and there's things to know about each type that's available. Now, we're not going to be able to cover everything today. We're just going to do a bit of an overview and cover some of the most common questions. Are you ready? Let's dive in. All right, for starters, for anyone who may have heard the term birth control but maybe not know what it is, birth control is any of the number of methods that work to prevent sperm from reaching and fertilizing an egg, which would then grow into a fetus and eventually become a baby. So this means that the basic goal is to prevent pregnancy, prevent unwanted pregnancy. So there's a number of reasons why a person or a couple may wish to do this. Those reasons can range from financial to maybe health, or maybe simply they don't want to be a parent or they're not ready to be a parent. But understanding the reproductive part of sexuality, as well as making some choices about what's right for you at different times of your life, is part of being a sexually mature adult. Only you can have the final decision on what's right for you. And along with making these choices, it's an important part of consent that you're having these discussions with your sexual partners. In an ideal world, our sexual partners should have the same goals when it comes to pregnancy as ourselves, whether that's trying to conceive and start a family, or maybe even just enjoying a bit of casual fun. Now, some people feel that sex should only happen when a couple is trying to conceive, but sex can be had for pleasure and for fun, and many people enjoy sex for this reason. Children should never be used as a scare tactic. Children can and are a joy, but usually only to those embracing the idea of having and raising kids. So if you're interested in sex for pleasure and not because you're trying to have a child, birth control is definitely something you want to look at and explore and know about. Now, as I mentioned, there's a lot of different types of birth control, and they all vary in effectiveness and expense and method. So depending on where you live in the world and what healthcare is available to you, this could really impact the types of birth control available to you. Now, some of the options include things like the patch, sponge, vaginal ring, birth control pills, the shot, or as is known, the Depo-Provera shot, implant, condoms, cervical cap, outer course, diaphragm, pull-out method, spermicide, IUDs, tubal ligation, vasectomies, abstinence, and more. I know that's quite a lot of options, and for the sake of time, we're just going to kind of quickly run over a few, and usually the ones that people ask the most about. One of the most popular options is condoms because they're cheap, typically easy to get your hands on. You don't need a prescription, and are also magical in the sense that they provide protection against sexually transmitted infections. However, I'm not going to delve deep into this option in this episode because we actually did cover these in a huge amount of depth in another episode. So if you're interested in learning about condoms or barriers, please check out that episode. I think we called it Condoms and Barriers. Good episode. Go back and check it out. So moving on, one of the ones I get the most questions about is the pull-out method. Is it effective? Does it work? What can go wrong? For anyone who doesn't know, the pull-out method is when people are having sex and the penis person pulls out and does not ejaculate inside the vagina. The reality is that the pull-out method does work, but it's really not the most reliable. About 1 in 5 people who rely on this method are going to get pregnant. So that's not very good odds, especially when we're looking at, all the different birth control methods available. The reason for its lack of reliability is that it does require a lot of self-control, and it's really susceptible to human error. The partner with the penis must be able to have absolute control over their orgasm, maybe be able to hold back into that moment until they pulled out completely. And even when that person does have that kind of control, there's still a margin for error. Premature ejaculation occurs, pre-cum happens. A lot of people have this discussion about whether or not any sperm is actually present in pre-cum. And the answer is basically, unless you've been to a laboratory or you've been part of laboratory testing to determine this, there is no way to know. I mean, we used to believe that there wasn't any sperm in pre-cum, and there was some smaller studies that seemed to confirm this. However, more recent studies looking at larger samples of people have actually found that approximately 1 in 3 of the participants had sperm in their pre-cum. At this time, we don't really know why some people do and why some people don't. So that's something to consider. And all these things really factor into how effective this method really is. Ideally, this method is really best used as a secondary precaution and used when combined with another form of birth control. So another common one people want to know about is the pill. The pill is a hormonal treatment that a person takes every day that releases hormones into the body. Now, these hormones do a couple of things like preventing ovulation, which is, the process of an egg being released. So they prevent that egg from being released. And they also thicken the mucus on the cervix, which actually prevents sperm from passing through to fertilize an egg. So it's kind of a twofold effect. If for some reason an egg is released, it sort of makes it a lot harder for the sperm to reach the egg. Now, compared to the pull-out method, the pill is significantly more effective. Only about 9 out of every 100 people will get pregnant, which makes it about 91% effective, even though it's said that when it's used perfectly, it's like 99% effective. So usually when it's less effective, it's because people have maybe forgotten to take it, or perhaps they've been sick and they've been vomiting or had diarrhea, so they didn't really digest the pill at that time, which can impact and actually throw off how effective it is for that entire month. Now, many people do like the pill because it is shown to reduce PMS symptoms, but it's important to know that like any hormonal option, there's some potential risks, and it's something you should really discuss with your doctor before absolutely choosing this method. The last one I want to quickly touch on is the intrauterine device, or IUD. Now, this is an implant that's placed in the uterus, and it's a popular option because they're mostly hassle-free and they tend to last a really long time. Once they are inserted, you don't really have to think about it, and it tends to be one upfront cost. And how long they last really depends on the type of IUD you get, because there's a number of different types, but it can be anywhere from 3 to 10 years, and they are 99% effective. Why? Because there's no chance of human error. You just kind of put it in, they do their job, right? Now, another kind of thing that's cool about them is that they can make periods lighter and more comfortable. There's hormone-free options. So there's a lot of good things about IUDs. And so I know some of you might be asking, okay, so what's the catch? What's the downside? Downside is that there are some side effects, and because they're more meant to be like a longer solution, the side effects can last for about 3 to 6 months. And the side effects are going to vary depending on what type of IUD is used, but it can include stuff like pain or cramping, backache, spotting, or even maybe some irregular periods. It's also important to know that while it isn't super common, there are definitely some risks that can actually lead to some pretty serious complications. And some people have had some really awful experiences where IUDs have migrated or not stayed in the correct place and have caused all kind of problems. So when you're considering this option, make sure you do your research. Have a really good conversation with your doctor about the best recommendations for you and your individual health situation. Now, there's a lot more that we could be covering here, and as I mentioned from that big long list of types of birth control, but we're not going to cover them just for the sake of time. But I recommend checking out my website, exploresextalk.com, or do a quick Google search for the type you'd like to learn about. There's definitely lots of options out there. I would definitely check out sites like WebMD or birthcontrol.com, I believe it is. It'll give you a really good rundown of what the benefits, risks, drawbacks, things to be aware of, things to think about. With so many birth control options, how do you go about finding the right type for you? There's a couple of things you want to think about and a couple questions that you and your partner want to ask yourselves before choosing one. Like a big one is, do you and your partner plan on trying to have children in the near future? Certain types of birth control have longer lasting effects. It can either take more time for the effectiveness to decrease or wear off, or they may just be designed for longer use. So things like the Depo shot, for example, it's not recommended for anyone who wants to get pregnant in the next year to 2 years to get the Depo shot, because it can actually take 1 to 2 years for the full effectiveness to wear off. So if you and your partner are planning on trying to conceive, you should choose a contraceptive that is reflective of those goals. It's an important thing to keep in mind when you're doing your research. Now, it's pretty important to remember that pretty much all of these methods, except for condoms, do not protect anyone against the risk of sexually transmitted infections. They are literally only trying to protect against unwanted pregnancies. So this is something to consider when choosing which one is your best option. You should be asking yourself, is there a concern about protection from STIs? Most options are, like I said, they're only going to protect you and your partner from unwanted pregnancies. So if there's a concern about the transmission of sexually transmitted infections, you and your partner should consider other safer sex methods to address those risks as well. Another important thing to consider is how much effort do you want to put in? Some methods, like the pill, require a person to remember to take the medication on a daily basis. Not everyone is good at this. And they say that, for the pill, to get the best results, it's important that they take it at the same exact time every day. If this seems like this could be an issue with scheduling or maybe remembering, once again, that's something you want to factor into your choice. How easy is it going to be to use this? When you and your partner are exploring options, you're also going to want to consult your doctor. Some forms of birth control may or may not be safe for you to use. It's going to be very dependent on your personal health history. Health issues that can really limit what choices of birth control you can use include any serious health problems such as high blood pressure, migraines, diabetes, or heart disease. Your doctor is also going to need to know things like if you're a smoker, if you have a current sexually transmitted infection, if you've ever had breast cancer, or if you have any blood clots, or if you have a family history of blood clots in the legs or the lungs. All of these things can impact which option may be best for you and your partner. Consulting your doctor is also going to be necessary for many forms of birth control that either require prescription or, in some cases, a doctor to administer them or put them in. Lastly, cost and availability may unfortunately be a factor. How much does this contraceptive cost? Is it covered by your medical coverage? We all wish that the cost of things didn't factor into our thinking or shouldn't have to factor into our thinking, but unfortunately it does. This may be a consideration for you and your partner. You may have to look at some of the lower price items, or there is also the chance that depending on where you live, some of these options may not be available to you. Once you and your partner can answer some of these questions, it's really going to help narrow down the focus as to what kinds of contraceptives may be a good fit. Finding the right method can take a little bit of research and, in some cases, maybe some trial and error. If you and your partner don't really like a particular type of birth control, another option may be a good idea to be explored. Just make sure you put in your research ahead of time. It's going to save you all kinds of grief down the road, and it can make a big difference. So that covers my quick overview of birth control and the very common questions that I get. If you have a question that I didn't cover, please feel free to send that question to questions@exploresextalk.com or, check out my website. I'd love to hear any questions, thoughts, or comments you have about today's episode, so please do not be shy. You can also leave a comment if you'd like on whatever platform you're checking this podcast out on. And also, if you enjoyed this episode, hit that subscribe button, like it, share it, recommend it to a friend. And we will be back next week with another exciting topic for you. So please keep your eyes peeled for the next episode. In the meantime, stay safe and stay sexy.